So yes, this is all, in the end of the day, it's about empowerment and it's about locus of control. So one can either have a disease and let the disease take ownership of one, or one can decide, I'm going to own my disease and make the most of the cards that have been dealt to me. And if you look on the internet and you look at different groups, there are groups like PD Warrior, and you talk to people who've had Parkinson's disease, and the people who are doing well just basically get on with their life and act like warriors. So in 2013, in movement disorders, the progressive resistance exercise training study was published, and it made it very clear several things. One, in a very controlled environment with a lot of support, people with Parkinson's disease will exercise for at least 2 years. I ran the study for 2 years because my view is if you can do it for 2 years, you can do it for the rest of your life. Everything in the book is about lifestyle change. The idea that you can do it for 6 months or a year is use it or lose it. Or as other friends have said, motion is lotion. Whichever way you want to look at it, you have to keep going. And what the study showed was that the signs of the disease, the amount of slowness, the amount of rigidity, the amount of postural instability that you have over 2 years is actually less at the end of 2 years than it was at the beginning for a group of 24 people. And as Christine has just alluded to, she's been doing these kind of exercises with people for 10 years, and they benefit, which means there is the ability to translate from tightly controlled research studies into activities that people like Christine do in her program. Now, the really difficult to understand part of this is that for many people, weight training is about toning muscle. And for those listening, if your job is to have toned muscle at the beach, yes, weight training does a nice job of toning muscle. But really, what my interest is in toning cognition. And if you look at the 2015 paper in Movement Disorders, 3 aspects of cognition also improved with resistance training over a 2-year period. This was actually voted Paper of the Year in Movement Disorders because for many people, tremor is a little bit embarrassing, a little bit annoying, but at the end of the day, so what? You've got a limb which shakes. Once your cognition starts to decline, this gets a little bit more problematic because people see people whose cognition precipitously declines. And therefore, the ability to hold or maintain cognition at whatever your level is becomes very important. And there's a considerable evidence across a wide variety of pathologies and also normal health that resistance exercise helps maintain and sustain cognition. It's kind of paradoxical, but it's true. The SPARKS-2 study was published in 2018 and showed preliminary evidence that exercising at a higher heart rate is good for slowing down the progression of the disease. In that study, 2 heart rates were used, 60 to 65% of your maximal heart rate and 80 to 85%. Both are very good for you. Both are quite consistent with World Health Organization guidelines, CDC guidelines, NIA guidelines. They're both very good for you. There is evidence suggesting the higher intensity may be better, and that's the reason the NIH funded me to do SPARKS-3, which is a large multi-site study looking at 2 exercise doses to see if there's a benefit of one over the other on a variety of measures. We're at the halfway point. We've randomized 180 people. We still want more. If anybody is listening, has Parkinson's disease, has not started medication, if you Google SPARKS-3, we have a web page. If I were to show you some of the email responses we've had to the study from people who've actually gone through it or who are going through it, you would be very impressed at how much the study has done for them. It is an excellent experience to go through.